will my varicose veins come back after treatment? When we're treating varicose veins, we're always looking for the underlying cause of the varicose veins, not just the visible varicose veins on the surface. We want to do a scan of your leg from top to bottom to see where these varicose veins are coming from. If we are able to find that source and treat that source by sealing the vein shut, then the risk of varicose veins coming back in future is greatly diminished. Varicose veins are abnormal, twisted veins which become swollen and inflamed. They are usually caused by blood flowing the wrong way down veins because of valves that are not working properly. This causes the blood to pool within the veins and become stretched, and this is what causes a lot of the symptoms of varicose veins. This is also what makes them visible on the skin. Treating the underlying cause of varicose veins is very, very crucial to get a good cosmetic and symptomatic results from your treatment. Varicose veins are often fed by what we call trunk veins on the leg, and if we find a trunk vein that is giving rise to the varicose veins lower down your leg and we successfully treat this, not only does that mean that you are less likely to get varicose veins again in the future, but it also means that you are much more likely to get a good symptomatic result from your varicose vein treatment, meaning less aching, less throbbing, and less swelling down the leg. If you have skin ulceration, then treating these trunk veins which cause the varicose veins lower down the leg is crucial to prevent future ulcers from forming. The modern treatments for varicose vein treatment involve closing the veins but leaving them where they are so that there is less risk of new veins forming at the site of the varicose veins. At VeinCentre, we primarily use endovenous laser ablation to do this, which is using a heat source to seal the vein shut. Doing this reduces the risk that the veins will ever reopen in the future, and also because there is not a space where the vein has been removed from, there is no chance of a new vein forming in that space, as we have turned it effectively into a small scar. We find that living a healthy lifestyle, keeping your weight down, doing lots of exercise, particularly walking exercises, are very good ways of improving vein health. If that is not sufficient to help you with your vein symptoms and you're not yet ready to have any intervention such as endovenous laser ablation or foam sclerotherapy, then wearing compression stockings can also be an effective way of helping the symptoms of varicose veins and also keeping them at bay so that they become less problematic over the long term. However, many patients find that wearing stockings in the long term can be a difficult process, so it's better to have your varicose veins treated, and if there is any residual symptoms or small veins that still are present, then wearing stockings may be a helpful way to alleviate that problem. So after treatment, we will have treated any abnormal varicose veins that we can find. So the risk of you having any residual varicose veins at that point is very, very low. We always aim to treat every visible incompetent or abnormally functioning varicose veins that we can find. However, there are a number of normal veins within your legs which could become problematic in the future. Varicose vein disease is a genetic condition and often runs in families, and therefore it is possible that some of the residual veins that we have not treated may become problematic in the future. However, the chance of this is actually very small. If you have any further questions about your varicose veins, or if you are unsure even whether you have varicose veins, then please get in touch with us.